we're going to go ahead and get started. Good afternoon. Thank you all for taking the time out of your day to join us for this incredibly important and timely conversation. I'm super excited about the program we have today, and I'm really looking forward to hearing what our panelists are going to say. I do want to let you all know that this is being recorded, just to give you a heads up. For those of you who don't know me, my name is Shelby Leonard. I'm a social epidemiologist. I'm also a public health planner as part of the Population Health Improvement Program here at HCDI. We are contracted by the state to support the county's health improvement plans, support disrupt and care coordination, and educate and support our region about the social determinants of health and promotion of health equity, which has really been our large area of focus recently. I want to firstly thank the Capital Region chapter of the American Foundation for Suicide Prevention, specifically Sandra Goldmere, for the guidance on developing today's program. July is Minority Mental Health Awareness Month, and the AFSP has dedicated a section on its website for minority health. They have a breadth of resources ranging from informative and educational to graphics and printouts to direct support for individuals in crisis. So I do encourage you all to check it out if you're interested. She's also on this call if you have any questions. So let's just go ahead and get started. Racial inequities plague our country, including right here in the Capital Region. Over the years, HCDI has produced numerous reports highlighting these large disparities in outcomes by race. In the Capital Region, Black non-Hispanics experience premature death 24.8% more than white populations. This is even worse in some areas of the region, such as Saratoga, where 19.3% of white non-Hispanics died prematurely, compared to an astonishing 61% Black non-Hispanic residents. So that's a huge discrepancy. Racism is the fuel for much of these inequities, including disparities in health. The experience of multi-level racism has detrimental effects on both the physical and mental health of our communities. In the Capital Region, Black non-Hispanics have higher rates of mental disease and disorder, depression, prevalence of poor mental health days, and higher rates of both emergency department use and hospitalization for self-inflicted injury. Suicide was the only mental health outcome in the area where white non-Hispanics have higher rates than Black. Today, we will be looking at racism as a trauma. We have some incredible panelists who have dedicated their careers to this very study and practice. We'll spend about half of our time delving into racial trauma and its effect on health, and the other half on healing from and coping with racial trauma and what we can do as public health professionals and healthcare professionals. Any time remaining will be for questions from the audience. You can put any questions you have throughout the discussion into the chat box. My coworker Mandita will collate these throughout the presentation. So if we don't get to your question, we will make sure to include it in follow-up resources. So please do put any questions you have into that chat box. Without further ado, I do want to introduce our panelists for today. They're at the forefront of this work, and I'm incredibly grateful they are here to share their perspective with us today. Rather than me reading their bio, we thought it would be nice to have the panelists introduce themselves. So if you want to just take a minute and let us know who you are and what you do. Alex, why don't we start with you?
Right. Shelby, first of all, thank you very much for the invitation to be involved in this important discussion. My name is Alex Petersey. I am currently an associate professor at the University at Albany. I'm also the training director of the Doctoral Counseling Psychology PhD program, and I'm also a licensed psychologist with a small private practice in Albany. My work over the years is essentially focused on psychological aspects of racism, looking at health-related outcomes, also looking at aspects of people's racial identity that might impact how they respond to racism. And more recently, I've been doing some work on racial trauma, and also trying to understand any mental health benefits associated with anti-racism advocacy and activism. So that's a very brief overview, and I look forward to participating. Thank you.
Vanessa, you want to take a second?
Sure. Thanks so much, Shelby, and I'm grateful to be here in such good company with you all, Dr. Petersey, and also Mr. Owens, talking about this. My name is Vanessa Volpe. I am trained as a developmental psychologist, but my work has primarily focused on applied developmental health psychology, so kind of an eclectic mix of those disciplines to really try to understand how Black individuals and communities resist and protect themselves against systems of oppression. And the majority of my work has focused on racism specifically, but my lab, I direct the Black Health Lab at North Carolina State University, where I'm an assistant professor. My lab has increasingly also become interested in intersectional social identity positions as well. So sexual orientation, for example, and gender as well. And the majority of my work looks at racial health disparities and tries to understand this resistance and protection. How can these Black individuals and communities really fight against racism in terms of what we're talking about today, anti-Black racism specifically, for the preservation of their health. And we try to use that information that we research. So I'm not a clinician or a counselor. I do research, not service-oriented work in that way, but we try to use the information that we get from research to hopefully help develop healing programming policies and other intervention, including systems level intervention, that can fight against the forms of racism that we see in the United States. So I'm really happy to be here, and I can tell you more about my training, but I also want to, if you have questions later, but I also want to mention that I'm really here also in gratitude to my amazing mentors who have trained me in this work. And I just want to mention their names so that you can learn more about them if you're interested. So I've been trained by some fabulous Black women, specifically scholars and leaders in the field, Dr. Eleanor Seaton, Dr. Alfie Breland Noble, Dr. Brandisha Tynes, and Dr. Anel Prim. So if you're interested in anything I'm talking about today, make sure that you check out their work. I'm here as a white person because I think that white folks are responsible for racism and should be responsible for its eradication. But I'm standing on the shoulders of those giants, and so I really encourage you to check out their work.
Thank you so much for that. Greg?
Hi, I'm Greg Owens. I'm the Deputy Commissioner with the New York State Division of Criminal Justice Services. I run the Office of Justice, and I've been there probably a bit over a year and a half. Prior to that, over 30 years with the Office of Children and Family Services, a lot of different leadership and management positions the last 10 years or so in front of the race equity work, looking at disparities specifically in child welfare and out-of-home placement, and also in the juvenile justice system throughout the continuum and throughout the various decision-making points. I also chair the Center for the Elimination of Minority Health Disparities at the University of Albany's task force for the city of Albany, of which Alex is a member, and work together to try and find ways to connect with the community about the various health-related disparities that they experience. I have been in the field of dealing with anti-racism since about, a long time. And the definitions of things, and I'm certainly happy to be a part of this work. I travel around the country and do work on implicit bias, the mind science of bias as it relates to dealing with racism, and other issues around leadership and responsible fatherhood. So I'm looking forward to spending time with you today, and I'm grateful for the opportunity, Shelby, and I'm glad to be with my two panelists, colleagues, and look forward to the work we're going to do.
Thank you so much for that. So I want to just jump right in here. Greg, I want to start with you. We often hear people refer to race as a social construct. And just to kind of level set here and start with a brief introduction, can you let us know what we mean by this and how race is a social construct?
Yeah, so as I look back over the years that I've been involved in this work, the introduction of race and racism has always been around the notion that race is a social construct, driven by the need to identify people and convoluted with the notions that we have about skin. So throughout the history of our relationships in this country, white scientists and pseudoscientists have spent a lot of time figuring out what to do with people who are from the African diaspora, who are people of color, who are Black and African American. And when it was convenient, the racial dynamic would shift depending upon whether the decision was made by a court or the decision was made by another institution. I also believe, at least more recently, that more than a social construct, race is a power construct. And so the definition that I learned many years ago of institutional racism, I think still applies today, but the new is by people like Dr. Kende and others also apply. The definition that I learned a long time ago was that the denial of scarce resources of power, privilege, and prestige based upon skin color in America is a definition of institutional racism that I'm most familiar with and that I learned while I was in school years ago. I think the notion of power, privilege, and prestige, who has it and who doesn't, and how it is used to not only marginalize and minimize people, but to determine life and death decisions in certain circumstances, is at the core of the power notion of race and racism in this country. So the current definitions that are ones that I think are more relevant. I think it is still rooted in this notion of denying people access to power, privilege, and prestige based upon skin color, which is the definition of institutional racism that I'm most familiar with. So it is a social construct used to control and manage people, but it is also about the power of the individuals to use that to determine sometimes life and death circumstances.
All right, well, let's jump right into the effects of racism on health. So Alex, as a counselor, what do you see in regards to the psychological impact of racism?
Shelby, that's such a large question. I'll try not to take over the whole webinar with that question, with my response. But look, I can respond to your question both from the perspective of a scholar and a clinician. So clearly, there is currently a very large body of research which unequivocally indicates that there are psychological with the experience of racism. And these range from, typical standard psychological reactions to stress, such as depression and anxiety. They also range to possibly more serious psychiatric illnesses. And also, clearly, there's now emerging evidence that there's a relationship between experiences of racism and symptoms of trauma. The caveat I will add is that because of the nature of the research, the research is largely correlational. And so it's establishing relationships as opposed to establishing causality. But clearly, the abundance of evidence indicates that there are definite relationships between experiences of racism and then negative health-related outcomes, and both for mental health and also for physical health. So from the perspective of a clinician, there are a couple of things I will say. The first thing I will say is that I think the experience of racism for especially for people of color and for Black Americans, I think the experience of racism does have some impact on who people seek out for health-related care. So as a clinician, I've had people reach out to me largely based on racial similarity. And I think that speaks to some of the experiences that Black people have had, which are associated with perhaps a certain level of distrust. Greg had alluded to the long history of scientific racism that we have in the country. So I think that's one aspect that might impact decisions that are made around access to care, availability of care, and it also might suggest also the need for more mental health clinicians of color in our community. The second point I will make is that clearly as a clinician, I see kind of in vivo the way in which research is supported. I will have people speak to me, and what is one of the most fascinating aspects, I think, of the experience of working around racism as a clinician is that people will share stories of racism, some that have happened recently, some that have happened many years ago, and the impact of this. I'll give an example. I've had people that I have worked with who in their schooling attended schools in predominantly white areas in the capital region. And some of the stories that they would share with me of really overt racism, the emotion associated with how they were sharing those stories, you felt as if they happened. It's going to get a chance more about racial trauma. I think what has been most striking for me as a clinician is to appreciate how real the emotional impact of racism is and how enduring it is. And then the ways in which the emotional impact gets added on, as it were. There's a cumulative effect as people continue to experience both indirect experiences of racism, but also more indirect experiences of racism. So that's one way I would answer or respond to that question.
Thank you for that. Building off of that, you've published multiple reviews and you've dedicated much of your research to the health related physical outcomes from the experience of racism. Can you give us, I know this is, again, could be a whole webinar, but can you give us just kind of like a summary of what you've come to understand about this and what you mean when you say that racism is a social determinant of health?
Sure. So as you mentioned, I've been fortunate to be involved in some of this research. The research initially started by trying to examine if there was a distinction between experiences of race-related stress and experiences of general life stress. And it's pretty clear that for people of color, for Black Americans, the experience of race-related stress almost has an additional and additive effect above that of general life stress. So that's where we initially started the work, and then moved more into looking at more specific outcomes associated with psychological distress. So as I had mentioned earlier, there now is a of research. In the past, reviews that have been published, and these are essentially statistical reviews of the research. And again, the research is very consistent that across a range of different outcomes, there is a relationship between experiences of racism and psychological distress. The one caveat I will add, though, is that so in research, often we are looking at perceived racism, experiences of individual racism, and at times by proxy experiences of institutional racism. So we'll and this is survey research, we'll ask people to complete measures of experiences of racism and then measures of different psychological states, depression, trauma symptoms, and then we will do statistical analysis just to assess the relationships. Again, the relationships are consistently positive, and the effect sizes associated with those outcomes are also relatively moderate in social science research. Let me briefly just make comments on racism as a social determinant of health. So by a social determinant, essentially we're referring to someone's social location and how the impact of social location is associated with various health-related outcomes. And so I think there are a couple of things just to highlight here which are important. Because we live in a racialized society and we continue to have a racial hierarchy which is based on power, Black Americans often have less social capital in the context of power, and that could result to impacts on allocation of resources, access to healthcare. And so there's one way in which structurally your social location determines health-related outcomes. So in addition to that, there is the experiences of racial discrimination, racism that I've just referred to, which is also about social location, which also is associated with health-related outcomes. And then there's a piece that I think has received some attention in the literature, and I think needs to receive more attention in the literature. But it's also about how your experiences when you access healthcare and how that is also associated with potential health outcomes. Some very brief illustrations of some of the experiences that I have had as a Black individual within the capital health area in accessing healthcare. And I think this goes to the experience of implicit bias. Okay? So in my engagement with healthcare, I have had people respond to me from assuming where I am on the socioeconomic ladder. The assumption has always been on people make assumptions about my ability to follow through with healthcare. I've had people make assumptions about my drug use. And I've had people make assumptions about my level of understanding, my basic knowledge of healthcare. And all of those assumptions have tended to be in the negative end of things. And so when you have these types of experiences, I think it influences your willingness to access healthcare. It also clearly influences your experience associated with healthcare. And those, I think, also then partly explain some of the racial disparities that we see in the literature associated with healthcare. So I've put a lot into the answer of that question, but I hope I've given some sense of what we mean by social determinants and social location, especially in the context of race and racism.
Yeah, thank you. Well, I appreciate that, that well-rounded answer. I want to bring Vanessa in here a little bit. You were mentioning, Alex was mentioning stress and this whole mental health and physical health thing. And, Vanessa, when we talked, you mentioned about the effects of racism, how it essentially is a physical and mental health paradox. Can you kind of elaborate on what you mean by that?
Yeah, sure. So this isn't my idea, though my colleague, Dr. Lori Hoggard, and I have done some research to try to follow up on this idea. But essentially, Dr. James Jackson and his team, in a paper led by Dr. Brianna Mazuk, hypothesized recently that, or relatively recently, that there's something called the environmental affordances model, which is, I'm just mentioning these things in case you're interested in reading the literature, but I promise I'll kind of unpack it for you too. And so in this paper, this model was trying to help researchers and scholars understand why we might see a paradox in Black Americans' mental health disparities versus physical health disparities, and how we can kind of reconcile that. So even though we know, as Dr. Petersey mentioned, all of that body of literature and his own work certainly has affirmed, right, that racism has these detrimental consequences for both physical and mental health. But sometimes when we look at mental health disparities, depending on what outcomes we look at in the United States, we might say, oh, Black Americans look like they're doing, pretty well. And that might also have to do with reporting and other things that are mentioned in the article. But when we look at physical health, sometimes we say, wow, Black Americans are really, suffering disproportionately from cardiovascular disease, which we know is really related to stress, for example, and can be catalyzed by stress. Those are just some examples, but this model was proposed to essentially think about just some of the coping or health behaviors that Black Americans engage in as a way to try to protect themselves and cope with these experiences of racism. Just some of those actually buffer against or protect them against the negative effects of racism on mental health, but simultaneously damage physical health. So for example, these types of behaviors that have been proposed are some things like emotional eating, for example, where you might be inclined to eat more fatty or salty foods, as we all do when we're stressed out. And maybe this stress of racism catalyzes some of these behaviors that make us feel better in the moment, but in the long term are also going to damage our physical health. Other things were proposed in the model, things like substance use behaviors, things like that as well, which we might consider mental health in general, but in the moment, they might be behaviors that folks are trying to engage in order to cope. And so that's the hypothesized model, and there was some initial evidence that was the case. And so I've been thinking a lot about this in my work, and a lot of my work, my earlier work, has focused on kind of this racial discrimination, as Dr. Petersey and Mr. Owens both mentioned, the notion of these individual interactions, sometimes called interpersonal racism, individual level racism, things that happen more at the individual level, things like microaggressions, and how that experience is important. So my earlier work has been trying to figure out what does the research suggest about how Black Americans are coping with racism at the level of these individual experiences, and how can we identify appropriate adaptive coping strategies that Black Americans are using to resist and protect themselves, but also they might be adaptive for mental health, but not adaptive for academic outcomes, for example, or they're adaptive for physical health, but not kind of you damned if you do, damned if you don't kind of notion. What's the double-edged sword? And so, for example, I've examined things like John Henryism, which has historically been shown to be challenging for physical health. So this is a high effort, active coping strategy that I could also spend an hour talking about, but I'll just limit it here to say that, a lot of my work is also focused on college students or emerging adults. And so a lot of the time, coping with racism means for many Black emerging adults has meant working harder in the face of adversity. I'm gonna work hard, and that's adaptive, right? That's a way that they're trying to cope and reconcile this racist environment and system that they're in and still achieve. But that, even though there might be benefits to academic outcomes, let's say, for example, there might also be challenges to mental health with that, of course. And we see that in the adult literature also, where those individuals who have higher levels of this high engagement coping might be more likely to suffer from cardiovascular disease, have high blood pressure, right? Because as Dr. Petersey alluded to, kind of this wear and tear on your body of constantly experiencing racism, both at the individual level as well as the institutional level, to which both of my colleagues have been referring as well as at the cultural level, as Dr. Courtney Cogburn and originally in Dr. James Jones' model of racism, thinking about how the media, how technology also kind of catalyzes these stereotypes and these ideas about Black folks that impact their own identity and image and place in the world. So, for me, the notion of this paradox, to circle back fully, is that, I'm always looking for the Band-Aid, the Band-Aid silver bullet that I can recommend as a researcher, not a clinician. But in terms of coping with racism, what's the Band-Aid? And I say Band-Aid because I really think, and I'm getting ahead of myself here, but I really think this addressing racism requires system-level structural change. But in the interim, what can we recommend, or what can I recommend as a researcher, really works in terms of coping in the moment with those individual levels? What's the Band-Aid that we can recommend? And sometimes in my work, a lot of the Band-Aids that I think might work out in my research haven't in the same way. So it's kind of a double-edged sword in many ways in my own work that I found coping can be, maybe, for example, if you have an encounter with the police, right? A lot of traditional psychology, stress and coping theory says active coping is the best. Well, what does active coping look like in encounter with the police? And do you really want to be, asserting, your rights in that context when you might have a more pressing life or death situation? And so that's kind of a more overt example of what I think about with the double-edged sword. What do we recommend, and how can we make sure that that's context specific? How can we make sure that what we're recommending and what we're acknowledging is both adaptive for the moment, so we can say Black folks do have strengths and resiliencies that they're bringing to the table and that they're using in everyday life to navigate this context of racism that is wearing them down emotionally and physically. But how can we acknowledge that while also making it so that there's a way that we can recommend something that is going to both help mental and physical health and not have any adverse consequences. That's what I'm trying to do with my life work. So I think it's important to keep that in mind. If we're thinking about, we want to recommend fast and easy coping strategies, we have to think about what do those look like in context, what do those look like in the context of racism, and in what ways are those going to impact other areas of life? If we're thinking about mental health, physical health, economic health and security, if we're thinking about safety, et cetera. So that's I think an important consideration for me in trying to solve this puzzle.
Thank you for that. I'm glad you mentioned coping, and we're going to get all into that in a little bit. But before we move on, I did want to ask you just to follow up a little bit on your research about the effects of racial stress.
Yes, me. Sorry, you cut out a little bit. You said.
I just said that I wanted to follow up with you on your research about the effects of racism, racial stress on health.
Yeah, I'll try to be brief, because I think like we've all been saying, we can all have many lecture series within ourselves and our expertise. And I'll just speak a little bit quickly about my work on stress physiology, because Dr. Petersey and Mr. Owens probably have done similar work and have already been talking about it in terms of some of the survey research or other kinds of research that they've been doing out there. So some of my work on racism and experiences of racism has focused on, and Dr. Petersey also mentioned this a little bit, alluded to it, the impact of stress on people's bodies as a way to kind of understand the ways in which, to use kind of a theoretical term, the ways in which the stress of racism gets under the skin. How does it infiltrate the way that our bodies work in adaptive ways in the moment, but ways that might be challenging long-term, especially for physical health in terms of the dysregulation of bodily systems. And many other scholars have done this work as well. We do know, as Dr. Petersey already mentioned, that racial stress is unique from other forms of stress. If we think about what it might be doing to folks' bodies at a physiological level in terms of things like heart rate, right, stress hormones, immune responses, things like that, those aren't things that we necessarily fully think about every day, but racism is a chronic, uncontrollable stressor. It's chronic because, it's pervasive, right? It's a pervasive experience, unfortunately, in the lives of Black Americans in the United States. And it's uncontrollable because unlike certain forms of stress that you might anticipate, like, oh, I have to take an exam in an hour, or I have to be on a webinar in an hour, or something like that, this could happen at any moment. And so what happens is, adaptively, Black folks are hypervigilant. Adaptively is not the same as healthily. I'll explain that in a moment, but adaptively, Black individuals have to be hypervigilant, always watching and looking in their environments for potential sources of racism or experience of racism so that they can protect themselves and respond appropriately. That hypervigilance is important in the moment because, of course, if you're not paying attention, you're in a hostile environment, then there's going to be consequences to your health and safety. But that hypervigilance, what your body does is it's always on. You're always on. It's kind of like, as I think I mentioned to you, Shelby, when I was first describing it, it's kind of like driving and leaving the parking brake on. The parking brake is very adaptive when you need the parking brake, but if you forget that it's on, as I have maybe done one a few times, it grinds against the road, and so then the parking brake doesn't work as well. Well, the same thing, if your body is always on, essentially physiologically, then it has a wear and tear. It's not going to work as well the next time because you're depleting all of your resources, and things like increased stress hormones that are constantly elevated, immune responses, dysregulated heart rate or cardiovascular systems. Those are just some examples. But essentially, racism can erode mental and physical health, even if we don't necessarily even if we are attempting to cope with it or we are engaged in coping with it, it still can leave a trace in our bodies that will have long-term consequences. So related to coping, we need to cope, but we also need to eliminate racism because even being in the soup of racism is going to have a trace on and in our bodies that is going to dysregulate them. And that's why we see morbidity and mortality, racial health disparities in the United States, as Dr. Petersey was talking about, in terms of a social determinant of health. And that's just at the individual level, but of course, the structural and cultural levels of racism also are kind of the soup that folks are in on a daily basis. And so they also have multi-pronged impact on those daily stress responses. So that's just one example in my work, how we're investigating the traces of racism as dysregulators for our bodies that have consequences long-term for health.
Thank you for sharing that with us. That is incredibly important work. Speaking about stress and this experience of racism, I want to bring Greg back in, and I want to kind of get your perspective on the effects of experiencing racism on children, and what role does racism play in youth gangs and violence that we see in youth?
Yeah, thanks so much. The effect on young people is as profound as Dr. Volpe mentioned they would be on any person, an emerging adult, probably even more so on an older adult who is like weathering racism and has, as a result, has health circumstances that they are generally being blamed for by a society that does not understand what systemic and structural and historical and contextual issues contributed to this. So for young people, the notion of hypervigilance, right? The idea that people are dealing with high levels of anxiety, the notion of engaging in risky behaviors, the idea of not being able to develop trusting relationships with adults. And I think what we have now is the idea of young people who are experiencing in communities right now that are experiencing high levels of violence, this notion of hopelessness, where everything seems to be pointed at them in the context and the framework of being a young person of color, and the anti-Blackness and the racism is always pointed at them. So why bother, right? So you got young people who are born into a circumstance that they did not make, living with family members who are constantly being targeted by the systems and the systems players on occasion, right? And so when you leave your house in the morning, you're walking through a community that may be experiencing hopelessness, certainly is not being treated equitably, and is dealing with racist players who either are completely ignoring them or are targeting them. And so if you are in school, you walk into school with that level of anxiety, hypervigilance, mistrust, etc., starting your school day. And then you have teachers who are not responsive to that because they think this is operating at simply the individual level. And so you are then in contact with a system that has a systemic response for young people who look like they are not complying and not conforming and troublemakers, etc. And so then the system of the education world responds, and then you see high levels of discipline, suspensions, etc. Again, that started out in a context of institutional racism within the community and continued for the child's entire day. So now they're in detention, or now they're in suspension or expelled from school. So I think the notion of how racism impacts young people is that it impacts from the moment they get up in the morning, actually while they're in the womb, but that's another conversation, yes? From the moment they get up in the morning and start getting ready for this day, you walk out into a situation where something could happen. And it could be related to the color of your skin, which of course is confounded by these notions of race. And so people then begin to target you, law enforcement may begin to watch you more. You've got to walk through this all day long. And then when you come back home, you're expected perhaps, if you're a student, to do your homework. The hypervigilance is not going away. The shame and worry has not gone away. The fear is still there. And so much of this is the result of racism and how young people are having to deal with it. And some of the coping mechanisms work for a while, but I think after this weathering occurs, as Dr. Volpe has described it, as I have described it in the past, it's the car that's constantly revving, things will break down. And so then you have young people who are now trying to find a way to feel better about themselves and better about their world. And so maybe some explore the use of illegal substances, etc., to try and get through a world of smoke and mirrors that they don't understand. And so I think these are some of the outcomes of young people dealing with a racist society that really is not something that they understand fully, not fully explained to them. And so they can't find the appropriate way to not just cope with it, not just develop resilience, but actually begin to engage in a healing process that they can use to kind of manifest their own destiny in the midst of a toxic situation. So that kind of leads into your next question, which was about the notion of race and youth gangs and racism in youth gangs, I think, right? So, yeah. So when I began doing youth gang work, I succumbed to the narrative that most people probably succumbed to at that time, which was, the largest youth gangs based upon the data being gathered at national levels are Latinos and Hispanics, followed by Blacks, followed by, at some point I woke up and said, we're dealing with a severe undercount and a failure of our systems to acknowledge that white children will even be involved in gangs. The definition of a youth gang simply didn't apply if you were 3 white children on the corner wearing the same colors. You probably were some sort of team. You probably were, as one of the professors, John Jay, said, you might have been a hockey team. But 3 Black young people on a corner wearing the same colors or just hanging out, they're a gang immediately, or have the potential to be a gang, or at least the potential to be 3 young people who are looking to get into trouble. And so race acts on the collection of data because there's an undercount, because people don't understand how they are undercounting white children who are involved in gangs. They are over-responding to young Black children who gather in groups. And you've often heard law enforcement say if it walks and quacks and talks and all that good stuff, it must be. No, that's not the case, because you're not being as diagnostic and as discreet as you should be, not asking the right questions. And so young people have been given the label of gang member when they are getting into trouble or being picked up by law enforcement when they're not even associated with gangs. But it is part of the narrative that is about anti-Blackness and racism, so that once you get that tag and you're in the system with that, that follows you. And so when it comes time for you to get attention from the system, whether it's by the prosecutor, whether it's from the judge, you end up possibly getting more time, don't get the opportunity to get probation in a timely fashion, get violated more readily because if you're in a neighborhood that has been deemed a gang neighborhood, and one of the factors about your probation is you can't associate with anybody who is, gang involved or engaged in criminal activity, but we have decided that whole community is a gang community. As soon as you walk out the house, you can be violated. And so I think that that's where race intersects with young people and this notion of, first of all, who's in gangs, and then young people who are gathering and forming actual gangs because they are being so alienated and dismissed by society that we do find places where we can go, we can connect ourselves with other people. And if that is other people who are being treated in the same fashion, well, now you've got 5 or 6 young people who are worried, who are shamed, who are angry, who are marginalized, and they're spending time together. So whether they're actually engaged in criminal activities or not, now they look like they're gang involved, and the response of the systems, whether it's education or school system or law enforcement, will respond accordingly. So I think race is a major contributor. I think race is something that causes young people to be over-identified. And I think that race can also be a factor that drives young people into situations where they gather with other young people experiencing the same thing, and then bad decisions get made. When bad decisions get made, you end up with another system that's identified you by the color of your skin, and now it's going to attach a label to you that makes it a bit easier to process you through the system because you're also a gangman. Those are some of my thoughts.
Thank you for that. Absolutely. I really appreciate getting that perspective of what this is like for young people. Before we move on to what we can do about it, I want to ask you, Alex, if you could just give us a little bit of an idea of what you see as intergenerational transmission of racial traumas.
Sorry, Shelby, I lost a little bit of what you said. Your question was about intergenerational transmission of trauma?
Yes, I think.
Thanks. So look, the first thing I'll say is in just listening to both Greg and Vanessa describing, the context of racism at various levels in our society, I think when we think about racism, especially from a generational perspective, in my work, I often will share with folk that in my understanding, I see racism in our country as a way that we organize our society. So it's really a principle of social organization, and it's been that way for 500 years. So you can't talk about intergenerational transmission of trauma without acknowledging that there's been a generational transmission of race. So so the simplest way, I think, just to kind of illustrate intergenerational transmission of trauma is for folks to think about the current response to police brutality that we have seen in the context of demonstrations of varying levels. And I would argue that the people demonstrating, especially color, Black folk, part of what is being demonstrated is not only the killing of George Floyd, but it's the killing of Emmett Till, Africans who came to this country. So the response is both to what you are currently experiencing, but it's also what you know about your people historically. And so there's an accumulative effect, as it were, of trauma that gets established over generations. And part of the way it gets established is the stories we have heard about our experience from our parents, from their parents, from our grandparents, the similarity in the stories, the emotions that I've heard my father express when he's spoken about his experience of racism growing up in South Africa are similar to some of the emotions that I've experienced when I've had overt experience of racism. So I think it's important to kind of recognize both that there is intergenerational transmission of both racism and then the trauma associated with racism. And the one final piece I'll say before we shift more to thinking about coping is Both Vanessa and Greg have mentioned this idea of hypervigilance. And in psychological terms, the concept of hypervigilance is an integral aspect of understanding trauma. And so it's not surprising that even though in regard to mental health disparities, much of the research will show that African Americans, Black Americans don't necessarily have higher rates of mental illness. There's lots of ways we can understand that. But there are two caveats. One is PTSD, so post-traumatic stress disorder. And I think there the concept of hypervigilance perhaps kind of lowers someone's threshold, the exposure to racial trauma. And the other caveat is mental health disparities is in the area of psychotic disorders, where American people diagnosed with psychotic disorders, but I think some of the thinking is that that's more a function of misdiagnosis than actual epidemiological rates. But again, the main point is that actual intergenerational transmission of we understood in the context of generational transmission racism.
So building on that, and Kevin Petersey said, what can we do about this racial trauma? So Alex, you know, from an individual level, what can we do to help people who are experiencing racial trauma?
So again, you know, as far as psychological interventions, there's lots and lots of evidence for what works in regard to responding to trauma. And I'll share just a couple in regard to how, for clinicians, how you can perhaps more effectively respond to racial trauma. One of the first points, and this is consistent with all literature around trauma, is the idea of validation. When someone comes to you and reports an experience of racial trauma, as a clinician, the first thing you want to do is convey understanding and convey a sense of validation of the emotions associated with the experience of racial trauma. Unfortunately, some clinicians who are less competent in the area of racial experiences, before they jump to validation and understanding, they are asking for evidence. Are you sure that what happened? Perhaps it was a misunderstanding. And so I think it's really important that clinicians are able to open themselves up and to engage the person's experience and understanding of racial trauma. And this is what we do as clinicians, period. So take what you do and apply it to the area of racial trauma. The other piece I will add is the idea of education. I think it is really important as clinicians to be able to provide psychoeducation to our clients of color who have experienced racism. So for one is we give them a framework or a context in which to understand the experience. The experience of racism, especially individual racism, often has an accompanying experience of shame or an experience of guilt, you know. And so the very act of providing a reframe, okay, this is something that is happening to you, I think is important as well. So providing some psychoeducation about what racism is, how racism operates in our society at both individual and at systemic levels, and then also providing a framework in which they can understand their response to a racist experience. And the response is not understood as dysfunctional, but it's a response that's understood as a kind of natural progression of being hurt, being injured. Shelby, am I actually answering your question?
Yes. Yes, absolutely.
I wasn't sure if I was getting a little off track there. The final piece I will add just about coping and perhaps responding to racism is the idea promoting the idea of activism. You know, so Vanessa has mentioned, you know, some of the, you know, kind of the risks associated with active coping. I will say that for me, helping people think about ways in which they can respond is providing a sense of being empowered, and perhaps they mentioned. And so there is some literature indicate that, especially youth, and some of this literature has been done with young Black men, the engagement in political advocacy, political activism, has a benefit of increased self-efficacy, which is associated with more higher levels of subjective well-being. So the idea of people to imagine themselves as being empowered and then acting through on that, I think also provides some benefit. So I will both.
I do know that I'm watching the time and see that, you know, we are coming up, but we have a few more questions, and I really don't want to cut off what we're going to say for this important conversation. So I do want to ask just a few more questions. If any of you guys have to leave, this is being recorded, but Vanessa, as a community, how can we begin to heal racial trauma? I want to get your thoughts and perspectives on that.
Yeah, thanks. You know, I think that however the organization or the local community, however community is being defined, the solutions and the input and the kind of how should resonate there. So clearly I'm in North Carolina and not in New York. So, and in your area, in the capital area. So, or capital region. So I am going to kind of speak broadly, but you know, you all as community members and as community partners in your various roles, really, I believe as a general practice should kind of guide what a community response that is healing and liberatory would look like. So I'll give kind of just general guidelines also with an eye on the time for kind of how I think about this. So first, I want to say that I really appreciated both my colleagues, but especially Mr. Owen's nod to history. And also, Dr. Petersey, you've mentioned kind of that in the context of intergenerational trauma as well. But I think it's really important for any community, however that's being defined in a specific context, to really understand not only the history of racism in the United States and how that constrains laws and policies and practices for the privileging and power and position of white people to keep white people in power, and kind of to use some terminology from the Racial Equity Institute here in North Carolina, to kind of make the invisible visible is a first step, because unless you kind of know that history, how are you going to kind of facilitate or collaboratively work on community-based solutions? And then I think also knowing the local history of that community, however that's been defined, is really important for creating something together. And I keep saying collective and together, because I think the other part of this is that it has to be done with the community and led by the community. But I think that knowing the local history is super important for being able to understand and develop something that's sustainable, something that's community-led, something that directly addresses those needs. I think we do have a kind of a tendency to be more global in our search for solutions, whether that be looking to research, right, or looking, you know, published online, or looking to kind of national activism organizations. All those are important. But I think really the local level is oftentimes we tend to not look there first for the cultural, historical, political wealth, community wealth, and capital of experiences that really, really can guide the initiatives and make them sustainable at kind of a more structural level. So I would say that. And I think certainly work on activism, I think, is super, super important, as Dr. Petersey mentioned. My colleague, Dr. Alon Hope at NC State, and I have been working on understanding activism and health and physiological health as well. So that's up and coming. But she also kind of thinks about activism in terms of a spectrum. So, you know, there are forms of lower risk activism and forms of high risk activism in terms of bodily or emotional or safety risk or social risk. And so thinking about that, I think, is super important, because I completely agree that often we take a deficit-based framework, whether in thinking about community or individual, Black community or individual initiatives, but really thinking about what is our goal? Is our goal to just kind of stop is our goal to stop the disparities, or is our goal to stop racism? And sometimes that can feel really overwhelming, but if we can envision, I've been thinking a lot about collective visioning for what's a future look like. What is a future in which people, Black people specifically, but then thereby all people, are free? You know, can that be our point? In the work of Dr. Della Mosley and the Psychology Collective for Radical Healing Collective have really informed my work in that way. And I will briefly just mention, I think another important thing that colleagues have been touching on as well is the use of counter spaces in different ways. So whether that be a counter space countering the dominant racist narrative of Black folks or their communities, whether that look like something specific in the therapeutic room, the therapy room, in terms of, well, this is what society says about you or your experiences, but what do you say about yourself? What do you say about your people, your community, etc.? Whether that look like online spaces. So recently I've been doing some work on Black Twitter counter space. I've also done some work on Black-centered affinity spacing on spaces on college campuses, such as special interest housing that centers African diasporic students and cultures, and how those can be counter spaces where Black folks and communities come in and pour into that space as a way to resist and protect themselves against these forms. And these types of counter spaces exist in your communities, I'm sure. Right? And how can, what's the role of any given organization in bringing about racial justice? I think the role is actually, you know, in what ways can we let the community lead? In what ways can we center the community rather than centering our organization? And that's really hard to do, but really thinking about at a community level, what does it look like? What does achievement of racial justice look like? I'll end with this contentious note. Does it look like your community organization no longer existing because there's not a need for it? So those are my thoughts. Those are my very quick thoughts about that. But those are the types of things I think about when I think about community healing or community-based work.
I feel like I could talk to all of you for an hour and ask you so many questions. But we'll move on to Greg. I wanted to get your thoughts on how do we begin on a policy level to address racism and its effects in both physical and mental health?
Yeah, at the policy level, and I'm going to be really quick because I know we're running out of time. At the policy level, I think we have to look at our policies through a racial lens, a lens of racism, and challenge the parts of our system where policy is either racist or anti-Black. And there are places in our policymaking process where we need to get people more skillful and more competent about understanding what anti-racism is and what to look for in the process of developing policy. Quick example, when I was at the Office of Children and Family Services, the gang work that was being done there, I was asked to write a policy statement about our work with youth gangs. And I said, I won't do it until I talk to a young person who is gang involved or has been gang involved and got out, or the parent of such a child. And that was not well received because our systems and our structures and our agencies are not ready for that. but I'm not aware of my being in a gang in my life, except, maybe the track team or the basketball team in some way, shape, or form, without the criminal activity. So I couldn't write that in good conscience, but I was able to do so after I met with a mother whose child was locked up for running with a crew. And so what consistent with that. So I think that that's how we have to engage in policy whenever we can. Develop people who can write policy and analyze it with a race equity lens, do racial impact statements so that the policies we develop don't have an unintended deleterious outcome for these communities that we say we want to be a part of improving, and then make sure that that we engage in that process on a sustained basis. That's how we engage in policy, using a race equity lens and making sure that racism doesn't get away. I think you're on mute. Shelby, we can't hear you.
Sorry about that. I'm just going to ask one last question. For any of you, any three of you have any thoughts that you want to add on what can public health and healthcare specifically do to support this? Any thoughts?
I'll start real quickly. Understand what we're talking about in terms of racism. Be more conversant so that you can lead the conversations. Engage in leadership work around this subject matter, and move quickly from the problem to the solutions, because we get enamored with the problem. And the last thing I would say is pursue what Vanessa has posited and what Alex talks about, which is healing. The ultimate outcome of this ought to be a society where we don't have these outcomes and that people can be treated with humanity. And you can't do that unless you heal.
Shelby, let me, sorry, I thought it was. You just add to that to say that we need to get away from the deficit narratives that we apply to groups of peoples, and we need to shift. So Vanessa's idea of counter-spacing, we need to do that in the academic realm, the social realm. We need to apply a different narrative and move away from the deficit narrative that we have for so many years brought to our understanding and our examination of people of color, particularly Black Americans.
I'll just say that I agree with both of my colleagues. I don't have anything to add further, but I do think that in the service of healing, in the service of liberatory and strengths-based perspectives, I'll just amplify what you said for a second. And then I think, the notion of power analysis in any policy or in research too, in what ways, who are you centering in what ways, and in what ways does your research, even unintentionally, reify and promote and perpetuate racism? I mean, that is the work in many ways from where I'm sitting.
Thank you all so much. I think that this is incredibly invaluable information for our region and working on our county health improvement plans and things like that. I did want to just give Sandra from the American, oh man, I'm going to say AFSP. I'm just going to say that. American Foundation for Suicide Prevention. Sorry. Just going to give her a few seconds, a few minutes here to kind of let you guys know about the work that they're doing and the resources that they do have around this. So you can take it away, Sandra.
All right, can you hear me? I'm not on mute, right?
Yeah.
So first of all, I just want to thank our presenters. I think that, all of the information is so invaluable, and especially it's just the beginning of what will be a long continued discussion about how we address minority mental health and do make it so that it's just about mental health and not putting people into different groupings, but that we should be looking at mental health on an equal playing field for everyone. But that also means addressing the fact that there has been systemic racism when it comes to mental health. And we at AFSP have really been looking at that as well. And from the inside out are starting to address that. we do have a lot of resources available for people, and our focus during this pandemic has really been creating a culture that's positive about mental health and really working to make sure people have access to resources that begin with simple mental health self-care, especially for people for whom addressing their mental health may be new to them for whatever biases about mental health that they have had in the past. And so I just want to offer the opportunity to check out our website at afsp.org. There is actually specifically, and it's so great that Shelby, that you organized this during mental health, Minority Mental Health Month. We have afsp.org/minority mental health. And there's a lot of amazing resources there. I do invite people to reach out to me, and I actually put it in the chat box. If they're interested, we do complimentary trainings as well on suicide prevention, mental health support, just about mental health self-care. And we'll be active in the fall, connecting people who have either suffered a loss or struggled with mental health themselves. And so just thank you so much to HCDI for putting this together, and for our panelists, and especially for the two who are in the Capital Region. I would really like the opportunity to talk offline more so that we can really talk about how we engage more discussion about suicide prevention and positive mental health with communities of color, and to partner with you through AFSP. So thank you so much.
You're welcome. Thank you, everybody, for coming today. We were very happy to have you all, and I can't say thank you enough to our panelists. Super informative.